If you have a teenager or young adult in your life, this next presentation may be of particular interest to you. Titled MyVoice, Texting with America's Youth to Improve Health, this cube includes faculty members from the medical school, the School of Public Health, and the Institute for Social Research. The team includes undergraduates from LSA and the School of Nursing, graduate students from medicine and the School of Information, and a fellow from medicine. Let's welcome Professors Tammy Chang, Michelle Moniz, and Kendrin Sonneville.
I, like my friends Michelle and Kendrin, are health services researchers. So my lab is my desk. My experiments are usually on the computer, and my team members are from across the country, including community members. And I also see patients as a family physician. And these one-on-one experiences with patients drives my passion for improving health through policy. So why policy? We believe one of the best, most efficient and effective ways to improve health of communities is through improving health policies. So typing on the computer, that's what work looks like for us. Exciting, I know. But sometimes the phone rings and it's a policymaker. And I say, yes, this is what I live for. I'm here to inform the decision-making of policymakers. Now I want to tell you what happens next, because it's at the foundation of why we're here today. So this policymaker on the phone invariably has a fascinating, important question, and I'll say, great question, I love it. No problem. Let me write a grant on that. I'll collect some data, I'll write a report, and I'll have an answer for you in 1 to 3 years. And that's when they say to me, whoa, Dr. Chang, I'm voting on this on Thursday. This is when I feel like the sloth. What's wrong here? What's wrong is that the pace and timeline of science doesn't match what's needed to inform policies in real time. We do not get a good return on our investment for research, and we really miss the mark. And so that's why we created MyVoice. We wanted to address the critical gaps in our understanding of issues affecting youth today. We collect their real-time thoughts and opinions and use that to drive policy change. So how do we do that? MyVoice is a text messaging poll of over 1,000 youth from across the country aged 14 to 24. We give them $1 a week to answer 3 to 5 open-ended questions. And we try to reach youth that are typically invisible, those that maybe aren't in the government data sets, don't go to college, are outside the system, but have thoughts and opinions that are critically important for us to understand. Traditional ways of understanding youth are insufficient. Typically, these surveys are on outdated topics, they're closed-ended, and they're analyzed years after data collection. Also, they miss important contextual information, the very information that policymakers, community organizers, and researchers need, the how, the why. We can do better than this. If you think about it, youth are typically middle-aged before we have the critical answers to the problems affecting their health today.
MyVoice brings together stakeholders like policymakers and youth-facing organizations to ask youth their opinion in real time using text message polling. And in this way, we can generate new insights and knowledge to inform policy. We ask questions about a variety of topics that might influence youth's health and well-being. Things like sleep habits, or diet and exercise behaviors, or sources of stress. One of the biggest challenges our team has had to tackle is taking open-ended, texted responses from over 1,000 respondents and rapidly transforming that into knowledge. We use a variety of mixed method analytics, including natural language processing, to be able to do this. And in this way, we can get the right people, the right information at the right time. Our team sees youth as central to every major health issue in our nation at this time. Youth is a time when people begin to have a little more independence and establish habits that lay the groundwork for their lifelong risk of chronic diseases like diabetes, high blood pressure, obesity, even some cancers. Youth is also a time when many mental health issues and reproductive health issues first present. Even though this population is absolutely central to the well-being of our country, many initiatives to reduce high-risk behavior in this population have not been successful. And we think that's because these initiatives have not been informed by the youth perspective. So let me tell you how we're getting at that perspective. We have built a sample of youth from across the country. We have oversampled Southeast Michigan so that our polling can pivot to policy issues that are relevant right here in our state, as well as at the national level. We are out in the community building relationships with policymakers, and we are also out in the community meeting youth themselves to make sure that the questions we ask are relevant to them.
We disseminate our findings through the traditional academic channels, but we do more than write academic papers and speak at scientific conferences. We create resources that respond to the needs of decision makers, white papers, infographics, testimony. For example, the Commonwealth of Massachusetts is currently considering legislation that would restrict access to diet pills and muscle-building supplements to individuals under 18 years of age. Researchers advocating for this policy wanted to hear from the youth it would directly impact. Our team was able to fill this need by asking our cohort of youth this very question: do you think diet pills and muscle-building supplements should be regulated for youth? And more than 70% of youth in our sample supported restricting access to these products for reasons that included disruption of development, risk of addiction, and body image concerns. This fact, along with direct quotes from youth in our sample, were compiled and submitted as written testimony for a hearing on this bill that took place just 2 weeks ago. MyVoice is able to gain insight into how youth think and feel on a wide range of topics, from essential health benefits that insurance provides, to sex ed, to gun control. And stakeholders at all levels, including youth, contribute to the topics we cover and the questions we ask. So why do youth participate week after week? Here are a few reasons in their own words. The money, just kidding. It helps, but I think it's important that I'm able to express my ideas, and I want my voice to be heard. I am helping with something bigger than myself. I like having a voice because I'm not old enough to vote. And what does it take to do all of this? It takes a huge team of talented people from multiple units across the University of Michigan. But more importantly, it takes youth. Our research team includes high school students, undergrads, grad students, med students, and postdocs, learners of all levels.
So where does MyVoice go next? We're working hard to build strong collaborations with policymakers now that we fit their timeline, because there's no precedent for that. We're also interested in understanding how MyVoice might empower youth, because we're asking them questions on topics that they may not think about on their own, like student debt or barriers to voting. So, bringing together amazing collaborators from across the university and with the help of MCubed, now when a policymaker calls, our team's going to be ready. We're going to be ready to fulfill research's potential to inform policies in real time and improve the health of youth. Thank you.